Antibodies are very, very important for the immune response, as shown by this graph comparing the primary response to the secondary response. The second time you get infected with something after you've already been exposed, you can see how much more quickly the antibodies are produced and how much more antibodies you produce. And that allows you to essentially be immune to this particular pathogen, right? You may get it, but you may not get any symptoms. You may not be contagious. You probably won't even realize that you got it. And there are several ways that antibodies help you deal with a pathogen. So first of all, they can neutralize it. So they can occupy binding sites. They bind to these proteins that are binding sites on viruses and bacterial toxins, things like that. And they keep them from being able to affect your body's cells. So they neutralize them from being harmful. They also can maintain that hold on them and make it harder for those pathogens to adhere to your body's tissues. So bacteria or viruses can't attack you. Right? And they also activate the complement system, which we talked about earlier on, which can cause a chemical cascade that does a lot of things to protect you and destroy cells, causing inflammation, etc., etc. Inflammation can also be caused by antibodies stimulating basophils and mast cells to release histamines. And we think of inflammation as a bad thing, but again, this is one of the ways that your body defends itself from attack. It causes dilation of the blood vessels in that area, which means more blood comes in, brings more white blood cells to defend you, flushes out toxins, things like that. And it's uncomfortable, but it often helps you fight infection. Antibodies can also cause opsonization, which means that when they bind to the antigens on the outside of a virus or bacterium, some kind of pathogen, they make it easier for phagocytes to grab onto and engulf that particular pathogen. And they also can chemically attract phagocytes, so neutrophils, eosinophils, and macrophages. And lastly, they can cause agglutination, or precipitation of these pathogens, which is exactly what we talked about with blood cells, right? Antibodies have multiple binding sites, and if one of them binds to an antigen on this bacterium and the other binds to an antigen on another bacterium, those bacteria are stuck together. And that bacteria over here may be stuck to a different bacterium because of other antibodies, and you get this clumping, and that allows your immune system to come and just destroy them all in one big swoop. This looks just like when your red blood cells agglutinate in a bad transfusion reaction. Now, our immune systems are complex and amazing things, but they do sometimes go haywire. And one of the ways that things can go wrong is you can have an immune response to something inappropriate, meaning, pollen, right? Oak pollen or ragweed or something, right? That's not attacking you. You shouldn't respond with an immune response, but we do sometimes. Or an excessive immune response to something that, like a bee sting, that might be a toxin, but requires a small response, not an overwhelming response. And these inappropriate or excessive immune responses we call allergies. You end up with a sudden increase in cellular activity, antibody titers, and it causes neutrophils and cytotoxic T cells to go nuts, and they may destroy normal cells in addition to your abnormal cells. And the antigens that trigger these inappropriate or excessive immune responses are called allergens. And allergies work more or less how your normal immune system works, in that you have an initial exposure to the allergen, which might not cause you much harm, but it sensitizes and activates your B cells and causes them to produce a whole bunch of antibodies, in this case immunoglobulin E. And the next time you are exposed to that allergen, those immunoglobulins will cause a huge stimulation of mast cells and basophils, and so you can get a lot of inflammation that you don't necessarily need, either localized or systematic. Sometimes this reaction comes right away. If you have a rapid, severe response to an antigen, we call that immediate hypersensitivity. Hay fever is an example of this, right? You get close to the hay and then right away, right, you start sneezing. Sometimes you can have localized reactions, and that might mean that you have, a bee sting and you just get a little bit of a swelling right there wherever the sting happened, or allergic rhinitis, you're sneezing just, where you get the pollen. But sometimes you can get systemic responses, and usually this means you had an allergen in the bloodstream, and this can be bad, right? So anaphylaxis is an example of this, where you get this acute, immediate sensitivity in your whole body, and often that means a bee sting on your hand can cause your throat to swell up or other things to react. And this means you can have mast cells and basophils throughout your body making histamines and causing inflammation, which means dilating of blood vessels, right? And if you have dilating of blood vessels everywhere, a lot more volume in your blood vessels means a much lower blood pressure. And that's bad, because if your blood pressure drops severely, then you may not be getting your blood to all the places you need to get it. And that's shock, right? When you're not delivering blood where you need to get it. So this is called anaphylactic shock, just like circulatory shock. So we've talked about your innate or nonspecific immune system and your adaptive or specific immune system. But both of those things work together, right? Neither one works alone. And so I want to do a quick overview of what your immune responses look like. So it starts by some pathogen entering your body with antigens on the outside, right? These molecules on the outside of the bacteria or viruses. And usually those are going to get eaten up by something in your non-specific immune system, right? So maybe some sort of macrophage. That's non-specific, but it stimulates your adaptive immune system. Because remember, antigen-presenting cells hold up in their MHC2, major histocompatibility 2, the antigens or whatever they ate, and they show it to the T cells. And if they find a helper T cell that has the correct antigen receptor, it'll stimulate a response. And that'll stimulate cell-mediated immunity. Those T cells, like cytotoxic T cells, for instance, will just go and actually kill the cells that are attacking you. And you'll form memory cells and suppressor cells also. And helper T cells will make chemicals to communicate with the rest of the body and organize the immune response. They will activate B cells, which will make antibodies. And then antibodies do all those things we just talked about, right? They will neutralize the pathogen, but they also make chemicals that attract your nonspecific immune cells, things like neutrophils, right, and eosinophils. The chemicals that the helper T cells are producing also are going to rally the nonspecific or innate immune system to help out and destroy this thing that you're looking for. So they work together back and forth, right? They're both pretty important. And an infection response can be a little bit different depending on whether it's a bacterial or a viral infection, right? Viral infections are also going to include cytotoxic T cells and or natural killer cells. So for bacteria, your bacterium infects your body. Macrophages will phagocytize it, eat it up, and become antigen-presenting cells. They'll activate your T cells, which will activate B cells, which will make antibodies, and which will take care of the issue. For viruses, you'll have that same thing, right? Macrophages will probably eat up some of the viruses and present those things to T cells, and you'll have antigen presentation, and T cells will activate B cells, which will make antibodies, and all those things. But you will also have natural killer cells and cytotoxic T cells, both testing out your infectious cells, looking at their MHC1 proteins and which proteins are inside of that, and seeing whether they're normal proteins or whether they're virally produced proteins, in which case they will destroy virally infected cells on their own. So you sort of have that extra component. Right, the last thing I want to talk about is another way your immune system can go wrong. So we mentioned it can go wrong if it overacts and has an inappropriate or excessive immune response. But it can also go wrong if it attacks your own body's cells. And this is called an autoimmune disorder. This means that you are recognizing self-antigens as enemies and attacking them. And this is obviously a bad thing. Now, how does this happen? Could mean that you had something go wrong during the negative selection process in the thymus, for instance. Or sometimes it happens when you had a foreign antigen into your body that you fought off, but that foreign antigen was very similar to something that you actually have on your body cells. And then after the fight, your body cells get confused. So, for instance, measles virus has an amino acid sequence on its antigens that's very similar to some proteins that you find on myelin sheaths on your neurons. And so this is the likely mechanism for multiple sclerosis, which is an autoimmune disease where you attack your myelin sheaths and harm the function of your nervous system because of that, and often it can happen in response to measles. In addition to multiple sclerosis, there are a lot of other kinds of immune disorders. Thyroiditis, where your antibodies attack your thyroid, cause inflammation. Rheumatoid arthritis, which is pretty common. Now, the most common type of arthritis just is your joints wearing out. But rheumatoid arthritis is an autoimmune disorder where your cells and your antibodies attack your joint tissue. And type 1 diabetes is an autoimmune disorder where you attack the pancreatic islet cells in your body that produce insulin, and you're no longer able to produce insulin sufficiently. Now, graft rejection isn't technically an autoimmune disorder because if you get a kidney that wasn't yours, right, and your body attacks it, it wasn't yours, right? So it's not autoimmune, but it is bad in terms of your health, right? And so you usually will take immunosuppressant drugs, things like steroids, like corticosteroids, which we talked about in Chapter 16, which will reduce your body's immune response and keep it, hopefully, from rejecting whatever piece of tissue or organ that you received from a donor. Now, this does mean that you'll have a reduced immune system going forward. Now, allergies and autoimmune disorders are overactive immune systems, responding to things they shouldn't or responding excessively to certain things. But you can also have an immune system that does not respond appropriately to actual threats. And these are immunodeficiency diseases. And this can mean you've had some issues with your lymphoid organs, or maybe you're taking immunosuppressive drugs, like radiation, or you maybe drugs to keep you from rejecting an organ. But the most common immunodeficiency disease that comes from a virus is AIDS, and it comes from the human immunodeficiency virus, HIV. And HIV infects your cells by binding to CD4 proteins, and that allows them to enter the cells. Now, the cells that you have that have CD4 proteins are helper T cells, right? Because those CD4s help you bind to MHC2 on antigen-presenting cells. And so, unfortunately, the cells that are attacked by HIV are the cells that coordinate your immune response. And so, what you would use to coordinate the response to kill this virus are killed off and infected by the virus. So if you have AIDS, you're more susceptible to things, infections that would not be that big of a deal otherwise. And so if you die of AIDS, you're really probably dying from an opportunistic bacterial infection, maybe a cancer that your body would have caught and fought off otherwise. And lastly, as you get older, your immune system begins to get worse. Your thymus has shrunk, you have fewer T cells, which means your B cells are less responsive. And this is why older folks are really encouraged to get vaccinations, even more so than most folks. And this lack of T cells not only means your B cells are less responsive and you'll have fewer antibodies, but it also means that your natural killer cells and your cytotoxic T cells are not as effective at looking for cancerous cells. And so as you get older, you are at much higher risk for cancer than someone who's a bit younger. In other words, wear a mask and take care of your old folks and make sure people are getting flu shots this season.